Hey everyone, we'll get started in just a couple minutes. We're gonna let a couple more people join the webinar and then we will get started. Thank you for joining us today. Okay, aloha everyone. Thank you for so much for joining us today. It is my pleasure to introduce Chrystal Cardoza, who is a second year student at the Daniel K. Inouye College of Pharmacy. Chrystal hails originally from the island of Maui, where she attended Kamehameha School and has been really involved in a number of our co-curricular activities, such as the flu clinics, the health screenings, as well as the health fair. And her dream aspiration is really to stay in Hawaii and practice pharmacy in the community that she grew up in. So without further ado, I'll hand it over to Chrystal, who's going to talk today about how to select appropriate over-the-counter pain relievers. Go ahead, Chrystal.
Thank you, Dr. Gu. Aloha mai kako. Thank you for coming. My name is Chrystal Cardoza. I'm a second year student pharmacist at the Daniel K. Inouye College of Pharmacy, and I'll be sharing how you may select the best over-the-counter pain reliever at your local drugstore. Next slide. Okay, these are our learning objectives. Today, I'll be discussing why it's important to make the best selection, how you can tell over-the-counter therapy is appropriate for you, and if so, what options you have. From those options, how you can make the best selection, and finally, how to take your drug of choice safely. So our overall goal is to help you to be able to personally select an appropriate over-the-counter regimen tailored to your needs. Okay. Next slide. So why should we care about all of this in the first place? Many people are not aware that over-the-counter medications do have the potential to cause serious or fatal complications when they're not used appropriately. For example, accidental overdose of acetaminophen, which is a drug widely used for pain relief, is the leading cause for calls to poison control centers, coming in at over 100,000 per year. It accounts for more than 56,000 emergency room visits, 2,600 hospitalizations, and an estimated 458 deaths per year. It is also the leading cause of acute liver failure in the United States. This proves just because a medication is available over the counter, it does not necessarily mean it's right or safe for us to use it whenever or however we desire. Accidents like these are preventable, which is why it's important for us to understand how to take our drug of choice appropriately. Next slide. So before we actually get into therapy, it's important to understand what pain is. We can think of pain as an alarm system. It's a natural response that alerts our bodies of potential or actual tissue damage. Once injury occurs, such as a hand sprain, the pain receptors located at that site of action will transmit signals to our nervous system and up to our brain in order for us to become aware that something is wrong and to act on it. How sensitive this alarm system is can be determined by multiple factors: stress, fear, age, emotion, physical health, dietary health, and especially a previous injury. Sometimes through various feedback mechanisms, that alarm system isn't reset into proper order, and the previously injured site becomes more sensitive to movement, which results in persisting pain. Overall, we can see pain as an unpleasant but protective symptom that arises due to some type of harm or disturbance to our body. Next slide. Since pain is a subjective feeling, in terms of therapy, we can classify it according to the intensity and the duration it's been affecting you. That's usually why doctors will ask on a scale of 1 to 10, can you tell me how bad the pain is? Everyone tolerates it differently. And in general, the types of pain that we are able to target with over-the-counter therapy are those in which we know what caused it to occur and it's not overbearing. So we know that our body can recover from that injury with time. Examples of these include muscle and joint pain, headaches, toothaches, wounds, and burns. Anything that's persistently bothering you, especially in an unfortunate situation where we don't know where the pain is coming from, that's a very big concern, and you should just see your doctor at that point. So overall, we're just aiming to relieve the symptoms of pain while the injury or the damage that caused it is healed or subsides. Next slide. So to emphasize our goals of therapy, again, we want to alleviate the symptoms of pain so it does not affect our quality of life, reduce the intensity and the duration, and prevent re-injury, relapse, or even worsening of pain. How do we do this? One analogy that helped me understand the big picture of therapy and how we can fight pain is the cup metaphor. I'm not sure if you've heard of this, but basically the cup is your capacity to tolerate pain, and the water that fills it symbolically represents the many different factors that can potentially cause that cup to overflow to the point where the pain is unbearable and it affects our daily life. There are two different ways we can address this. The first way is to build a bigger cup, so essentially building our tolerance to pain, or we can decrease the volume of water by addressing those specific factors that cause the cup to overflow. Next slide. So this is our game plan. Your non-pharm therapy is going to be your defense. It aims at building your tolerance by preventing the cup from overflowing or overtaking you. Your offense are your OTC pain meds. In the case where the pain is overbearing, this will help chip away at the volume that it has over you and put points up on the board to help you win the battle. Herbals, I guess, can be your special teams, so it's something that you can consider if you want, but it's more of a complementary form of therapy and they're not as dominant as the other two forms. So starting with our defense, the non-pharm, usually this is the first form of therapy that you want to try first because it's better to prevent pain than actually have to treat it. And this form usually comes with the least amount of side effects. So for non-pharm in general, the healthier we are, the better we feel. So if we live a healthier lifestyle, our body becomes more prone to fighting pain and disease. The most dominant factors that could contribute to wellness are diet and exercise, which is usually why it's stressed so much. I'm sure everyone heard the term, you are what you eat, and that definitely rings true in building our strength and tolerance. For example, in one study, the anti-inflammatory diet was proven to reduce the severity of pain in women with fibromyalgia, which is basically a disorder that's characterized by widespread muscle pain, and it is accompanied by fatigue, sleep, memory, and mood problems. So even in chronic situations like this, our diets can play a critical role in defending us from suffering. Usually the optimal diet concentrates on cutting back sugars, carbs, red meats, and focusing more on fruits, veggies, and seafood. The Mediterranean diet is a good outline to follow in that case. Another thing that you can do is, of course, avoid triggers that make the pain arise. And a lot of times that does go back to our diet. So for example, some people who get headaches, they can drink coffee and that can cause the pain or the headache to arise. So just taking the step to realize that those things are occurring and cut back on them can be an effective preventative measure. Also, since I mentioned pain is subjective, some other natural remedies we can consider are comfort and distraction therapy. Next slide. So although everyone perceives pain differently, for some people, just shifting our focus on something other than the symptom itself can be an effective relief. I think a good example of this is when kids have to take their flu shot. Many times I think just the anxiety of them getting vaccinated can intensify their pain, but I've seen flu clinics, usually the vaccinators will provide kids with like a stuffed animal or a sticker to kind of pacify them. And in my situation, when I was little, my mom used to bribe me to a trip to Fun Factory. Otherwise, I'd probably be like flying 90 miles an hour out the door. But just to illustrate my point, if you can somehow shift your focus on something other than the experience of pain itself, maybe by doing something that you enjoy or things that relax you, it can help you cope and weaken the severity of pain and the way that we perceive it. Again, so we're trying to build our cup or our tolerance. So those are some things that we can do in general, but specifically for muscle and joint pain. Our main form of therapy we can use is RICE. So rest, ice, compress, and elevate. The general rule of thumb, ice therapy is mainly used for recent injury or re-injury, so up to 72 hours after the onset of pain. It works by decreasing blood flow to the affected area, thus decreasing the swelling. Heat therapy is the opposite, so it draws in more blood to help relax our muscles, which can be helpful for certain cases, but of course in injuries where the swelling is intense, and that usually is accompanied by recent injuries, you want to avoid using heat therapy because it can make matters worse. So should any of these forms fail you, then we can start relying on our offense for support. Next slide. These are our OTCs, but before we draft our quarterback, there are a few factors that we have to take into consideration. So these are some questions that you want to ask yourself before you make your selection. How severe is your pain? How has it been affecting you? Where is the pain and is it concentrated? Do you know what caused it? And is there anything that triggers it? Next slide. Some things that you want to keep in mind while you answer these questions are OTC pain relievers are basically used for mild to moderate pain that lasts less than 10 days. Any severe injury or associated infection should be treated with the help of a doctor. If you do meet the criteria for over-the-counter therapy, then we can start weighing our options. So the first form of therapy that is best to try is topicals. Topical analgesics are primarily used for localized pain, specifically pain associated with your muscles and joints. Going through some examples, menthol, camphor, capsaicin, salicylates, and diclofenac. These drugs help desensitize pain receptors either through their heat, cooling, or anti-inflammatory effects. Since they are absorbed only through the skin, they do come with minimal side effects. But with that being said, that doesn't mean it's safe to apply like the whole bottle to the affected area in one day. Please follow the directions on the label, because if you happen to overdo it, you are increasing your chance of the product being absorbed in your body. And that will come with side effects. Likewise, if you use topicals in combination with heat therapy, or if you use it under a tight bandage, or even if you use it on broken skin, you're also increasing that risk of absorption as well. Another important thing to note, when you apply topicals, it's always good practice to use gloves before use or wash your hands after use. You don't want to get the product on your eyes or accidentally ingest it, because if that's the case, it probably won't be a fun day for you. But other than that, topicals are always good to try first since they're relatively safe. In the case where this does not work for you, or if the pain isn't extensive, then we can try our oral analgesics. The first being acetaminophen, which is a drug commonly known as Tylenol. It is both a pain and fever reducer, and it is generally the safest oral analgesic to use since there are less concerns of side effects or interactions. I kind of think of this drug as like the Tom Brady of OTC pain meds, because if you choose to have him on your team, you'll know it can be dependable and it generally works well with most conditions and other medications. But somehow many people still underestimate the damage that he can do, and particularly with this drug, it may cause severe liver damage, even death if it's not used appropriately. This is why the FDA recommends limiting the total daily dose to 3,000 milligrams per day. To avoid this potentially fatal effect, you do not want to use this if you have any liver damage or if you have a consistent alcohol intake. It's a great drug in general, and safe to use, but please follow the directions on the label. So your second choice are your non-steroidal anti-inflammatory drugs, also known as your Nsaids. As seen in this name, this product does help fight inflammation, and like acetaminophen, it can be used to reduce fever as well. Examples of Nsaids include ibuprofen, also known as Advil or Motrin, naproxen, known as naproxen or Aleve, and aspirin, brand name Bayer. In addition to relieving pain and fever, they can thin your blood, which is why it's a major side effect you want to look out for is GI bleeding. With that in mind, you want to avoid this drug if you have any kind of stomach problem or bleeding disorders, and please avoid high alcohol and garlic supplement intake, since that does increase the risk of this adverse reaction as well. Further research also notes that NSAIDs can cause serious heart-associated events or kidney problems when they are used for prolonged periods of time. If you have any heart or kidney dysfunction, you want to avoid these drugs for those reasons. And like all other medications, you want to follow the directions on the label for your safety. So in summary, for muscle and joint pain, your first line agents are going to be your topicals, since it's primarily used for concentrated pain. Examples of these include camphor, menthol, and capsaicin. Always use gloves or wash your hands upon administration, and never use on an injured or damaged skin or in combo with tight bandages or heat therapy. For extensive pain, we can resort to our oral analgesics. It is the safest drug when used appropriately, which is Tylenol or acetaminophen, and it does reduce both pain and fever. Liver toxicity is a major adverse effect, so you want to avoid this drug if you have a compromised liver function or you drink high amounts of alcohol. For inflammatory pain and fever, we can use NSAIDs. Examples of these are ibuprofen, naproxen, and aspirin. You do not want to use this if you have a heart disease, bleeding disorders, any kind of stomach problem, or if you have a kidney dysfunction. You also want to avoid high garlic supplementation or alcohol intake, because it does increase the risk of adverse effects, particularly the GI bleed. So now that you know what's out there, it's important to understand how to take your drug of choice safely. If there's anything that I want you to take from this presentation, it's how to read your drug label. And I know it seems silly, but many people do not pay attention to this, which is kind of understandable. I admit there's times where I walked away from my pharmacy with like 100 different papers stapled to my prescription bag. And sometimes it just like gives you a headache looking at it. But it is there for a great reason, particularly your safety, which is why I'd like to run through it with you. So the first thing you want to take a look at is your expiration date. For the same reasons why you'll look at an expiration date on a milk carton in the grocery store before you purchase it, you want to look at your expiration date on your drug label. So the drug expiration date is a basis of time which tells us how long the drug will remain stable, which means it maintains its strength, quality, and purity needed to be effective. Since drugs do break down over time, it's important to refrain from taking any expired drug, since there is potential that it can cause organ damage and will most likely be ineffective anyway, so it's just best altogether to avoid taking expired medications. Storage goes hand in hand with your expiration date in terms of assuring that the drug remains stable, safe, and effective for you to use. Most drugs require you to keep it in a cool, dry area away from children and pets, but some drugs do have potential special instructions. For example, keeping it away from light, and this is why it's important for you to follow these instructions as well. The ingredients are another very important component to look at. Concerning costs, sometimes the brand of a drug can be 3 times more expensive than the generic, but as long as the active ingredient and the strength or the dose of your drug is identical, it clinically will work the same. I personally am cheap, so if that's the case, I would just buy the generic to save the money. In terms of safety, there are many OTC products that contain the same active ingredients, and a lot of them are combo products because it can help you tackle different symptoms in one pill for your convenience. I think a lot of people misinterpret the brand name of a drug for its active ingredient, and that innocent mistake can be very dangerous. Nsaids are found in over 900 drugs and acetaminophen found in over 600. As I mentioned before, there is a limit on the dose that you can take for Tylenol, and this is a common way people do overdose. In one case on the mainland, there was a patient who took Tylenol, NyQuil, and Theraflu all for her cold, which contained acetaminophen. So you can imagine that that daily limit did increase up to that 3,000 milligrams very quickly, and she ended up needing an emergency liver transplant. This is why reading what's on your product can be life-saving in situations like these. Another important portion you want to look at is your inactive ingredients. They do not have any therapeutic effect, but they do help with the transport and the administration of the drug in your body. In the case you are allergic to any component, it's always good practice to look at that section as well. If you forget everything that I just went over, the uses will tell you the FDA approved indications of your product. Next slide. Any pertinent precautions will be found in the warning section as well as in the drug facts. Next slide. Next slide. And the most important part is your directions on your label. Always follow the label's directions unless you're told otherwise by your doctor. Just reading your label in itself can be life-saving and prevent accidents like an acetaminophen overdose. Next slide. So apart from our OTC medications, another thing that people can consider are your herbals or your specialties. Here are some common options according to the different types of pain. So several studies have suggested the use of tea tree oil for the treatment of acne, dermatitis, and gingivitis. Thus, it can be a great regimen for inflammatory relief. Vitamin C and ginger also have anti-inflammatory effects. Protein strengthens muscle fibers and it reduces muscle pain, which is why athletes usually consume it pre or post workout. And natural eggshell membrane, or NEM, can reduce pain and stiffness associated with knee osteoarthritis. For headaches, peppermint has a cooling effect and lavender can support relaxation. For toothaches, clove oil acts as an anesthetic to numb the site of pain, and again, the peppermint tea bags for the cooling effect. And finally, for burns, we can use aloe vera or honey, which have good soothing properties. So although these may be good options for you, we also have to be cautious when taking herbals. Unlike OTC and prescription medications, the contents and side effects of herbal supplements are not monitored as closely since they are considered more of a food than an actual drug to the FDA. OTC and prescriptions require numerous clinical trials to take place in order to assure patient safety before and after they are released to the market. In contrast, studies for potential side effects for herbal products are not monitored before they are released to the public. There are, however, quality assurance programs who do voluntarily oversee the contents of supplements. If the elements do accurately match the product's label, you'll find a verification seal on the top of the bottle. So USPF, NSF, and Consumer Labs are companies that participate in these studies. So if you do decide to go down this road, I do recommend looking at a product with one of these verification seals on it. With herbals or any medication, I just want to stress the point that you should inform your doctor if you are taking them. Some drugs can cause severe damage to your organs, and a lot of times we may not be aware that it's occurring. but something like that can be caught through blood work provided through your doctor, which is why it's very important to inform them about it, since they can monitor your safety and improve your treatment if necessary. Next slide. In the case the self-care approach is not working for you and the pain is not going away or even gets worse, please see your doctor and keep in mind that OTCs are only meant to be taken for 10 days or less. If you are unable to take an OTC pain reliever, please consult with your doctor to weigh out the risks and the benefits so they can work with you to find the best form of therapy. Okay, so in summary, how we can select the appropriate OTC medication. First, we have to determine if OTC is appropriate, and we must try our non-pharm options first. We want to take into consideration any condition or medication that can interfere with OTC drugs. And once we make our selection, we have to read our drug label so we can take our medication safely. Next slide. That's all I have for you. Thank you for coming.
Thank you so much, Chrystal. If you guys have any questions, please type them into the Q&A tab at the bottom of your screen, and Chrystal will be happy to answer them. I'm just going to give a few minutes for question and answer. All right, looks like there's not many questions. So excellent job. Thank you, Chrystal. Thank you for that great presentation and all that great content. Thank you, everybody, for joining us today. And yeah, we'll tune in next time.